Hello everyone. Today we ask the question, how do we swallow food and drinks? We will talk about how the muscles in our head and neck work together to bring food and drinks into the stomach, and how the body prevents food and drinks from entering the lungs. We have listed relevant research in the video description, and the authors of these articles will pop up in the upper right corner when their findings are relevant to what we are talking about. Here we have the side view of the head and neck. When we are eating, we put food into our mouth and start chewing. This mixes the food with saliva and forms a cohesive unit. Prior to swallowing, some food may slip into a pocket of space behind the tongue, known as the vallecula. In contrast, here we are looking at the drinking of fluids rather than the eating of solids. In this case, before we are ready to swallow, the tongue rises to prevent fluids from prematurely entering the throat, otherwise known as the pharynx. When we are ready to swallow, the tongue propels both solids and fluids into the pharynx. At the same time, the soft palate will rise to prevent things from entering the nose. Here we see the back of the tongue, known as the base of tongue, come together with the walls of the pharynx. This pushes food and drinks downwards before the upper esophageal sphincter opens. This allows food and drinks to pass through into the esophagus or food pipe, which links the throat to the stomach. We also see that the larynx, which is the entrance to the airway, has elevated during the swallowing process. A piece of cartilage known as the epiglottis has also moved downwards. Together, they reinforce the barrier that prevents food and drinks from entering the airway and lungs. At the top of the airway, we have a pair of tissue known as the vocal cords. From the top view, you can see that they are next to each other, and during breathing, the gap between them allows air to move in and out. However, during swallowing, the vocal cords will come together to form a seal that further prevents food and drinks from entering the lungs. At this point, I thought it might be interesting to share that the vocal cords help us talk, as the name suggests. They achieve this by coming together and vibrating, when air is moving out of the lungs, as shown here in the diagram. So that is essentially how a swallow looks like. It is also important to know that when we are not swallowing, the esophagus or food pipe is closed. This prevents reflux, which refers to materials moving back up the esophagus. In talking about normal swallowing, I thought it would be good to point out as well that as we become older, research suggests it is normal for a small amount of fluids to enter the airway during swallowing. This happens about 2% of the time for people in their 70s and about 6% of the time for people in their 80s. Since it's really quite a small amount that's going into the airway, the volume is often not enough to trigger coughing, as in or clearing of the throat, which is The body usually initiates coughing and clearing of the throat to efficiently expel unwanted materials from the airway, but in this case, they don't happen. Nonetheless, the airway has other means to get rid of unwanted materials. Namely, the walls of the airway are covered in mucus, and this traps foreign substances. Then we have hair-like structures called cilia that sweep up and down, which can move mucus up and out of the airway, along with the foreign materials. And that's all I have for today. I hope that has been helpful. Feel free to let me know if you have any questions or feedback. Have a great day everyone, and see you next time.